healing technique eliminated his need for medications. You'll also learn about a hidden threat to liver function and how to avoid years of unwanted stress in your life. Plus, you'll finally understand how the body gets stressed out in subtle yet significant ways on a daily basis, and most importantly, how you can avoid getting hurt. Enjoy my conversation with Dr. Matthew Rowe. So, Dr. Rowe, before we get into what I consider to be a really important thing for a lot of people out there when it comes to making their liver less toxic, we'll get into all that. Why did you get into being a chiropractor? What turned you on to this profession?
Well, I was so interested in trying to help people function better and help them find an alternative to traditional medications. When I was 6, I fell out of a tree and landed on top of a picnic table. And when I landed and I hit the back of my head on the surface of the table, and I fell through the area of the table and the bench. I got up, I was 6, I brushed myself off, I kept playing. But it was about 6 months after that I started getting headaches. And so I started having severe pain at the base of my head that would wrap around into my face, and it would cause me to be sick. And so as time went on, these headaches got worse and worse and worse. And so I tried traditional medicine, took a lot of medications, a lot of over-the-counter medications, and what I was doing is I was just managing the symptom. It would take it away, but then it would come back. And so I started studying chiropractic, and I was looking into, how can my body function better without relying on medications? And it wasn't until I got into chiropractic school that somebody said, hey, you need to look into this upper cervical stuff. And so I went to see an upper cervical doctor in Atlanta when I was studying at Life in chiropractic school. And they looked at my body differently than everyone else, including chiropractors. They looked at my upper neck where a lot of my situation, a lot of my problems were happening. And the way they analyzed and corrected it was very different. And it was about 6 months after I got that very first correction in my neck that my headaches went from daily to weekly to monthly. And now I haven't had a migraine headache in over 12 years. And so it dramatically changed my trajectory in life. I was taking medications every single day. I was the kid that took a bottle of Tylenol to school with me. And so through the upper cervical corrections and through the direction of the upper cervical chiropractor, it changed my life. And so that's why I'm so passionate about what I do now. That's why I'm so grateful to you to have something like this, so that way people know there's another alternative, that they don't have to turn to medications. They don't have to survive on medications. I suffered for 17 years. It took me 17 years to find somebody that listened, that looked, and corrected my issue. And then over time, my body healed itself.
It's great, Dr. Rowe. For people following me over at Natural Health 365, they know that you're my upper cervical chiropractor. And I've personally experienced a lot of great things, but you just really nailed it as to why I'm so glad that you're a part of this event. Because so many people are looking for ways to feel better with their liver and the whole rest of their body.
Right.
They're taking medications for other reasons, but if they can get their spine just right, a lot of these drug dependencies can just fade away. So I really want to get into this. Yeah. Talk to me about the difference between an upper cervical chiropractor and the traditional chiropractors that people know about.
Well, as an upper cervical doctor, we address the whole spine. There's a big misconception that we're only working on this area and we're only concerned about this area, and that's not true. We're concerned about the entire spine. But the way we look at the spine, we take more of a top-down approach because the upper neck is different than anywhere else in the spine. It doesn't have big interlocking joints that keep the bones from moving. And so these top two bones can move very freely. And a lot of times, like in my case, falling out of that tree, it shifted that bone out of position where over time I developed damage to the nerves up there. And so because of the way the anatomy is, it allows us to correct these specifically in a more gentle way. And so we kind of look at the spine as an electrical panel in our house. We've got the main power switch at the top of that panel that when we need to turn the power off to the house, we flip that switch. But then we got the smaller switches that control or coordinate the bathroom, the kitchen, the bedroom. And so when we look at the spine, our main power switch is the upper neck. It's the C1 vertebrae because it houses and protects so many vital organs and brain tissue and everything up in this area. And so then we've got areas in the lower neck that might control our heart or our thyroid or our lungs or the power to our hands and our arms. The mid-back, low back that controls our liver. It controls our kidneys. And so when we address the spine, we look at the main power switch first, but then we go in and look at the other areas, because if there's a damage to this area, it's going to affect the body's ability to function and heal.
I want to focus in on how the spine can affect liver function, but I think it's very interesting what you already just said about how, I think like anything else, a little bit of chemicals, a little bad food, what you had said is so important for people to keep in mind. This is something that can go south on you, a misaligned spine that over time does the damage. Took you half a year to get to this severe head pain. So many people could be suffering with this kind of nerve impingement, nerve trouble that literally gets worse month after month after month. It's almost hard to recognize, I guess, a lot of times where it all began. Is that fair to say?
Absolutely. In our office, we say these things aren't events, they're processes. And so it's typically not A happens, B happens, right? And so many times people have issues that they never even know. And many times these issues are there for 5, 10, 15, 20, 30 years. And for 30 years, their body has been degrading. Their body has been functioning poorly. And now we develop a symptom. And many times people wait until they have the symptom before they start to address, the cause, because they don't know.
And worse yet, they're attributing their pain or their suffering and their stress that they might feel in their body, even if it's not such an acute pain, to a tough day at the job, a lousy boss, a stressful situation at home. And yet they don't realize how if they just get themselves right, they will feel physically, mentally, and emotionally so much better. So let's get into it a little bit about specifically how if the spine is not doing well, it actually will physically, literally have a negative impact on the liver.
Yeah, absolutely. Our spine houses and protects our nerves. And so our brain communicates with our body constantly. It sends trillions of messages to our body all the time. These messages are what keep us alive. And so if there's a misalignment in the neck that's causing pressure on the nerves, then what happens is the body can start to distort those messages. And so our brain sends messages through our upper neck through something called the brain stem. And the brain stem is a piece of the brain that is basically the pons, the midbrain, and the medulla oblongata. And it's responsible for all of our body's autonomic or automatic functions. And so it sends signals through this area out the network of nerves, and wherever these nerves go to, those cells function. And it's a very simple process. If the cell functions properly, the cell does what it's supposed to do. And so in the case of the liver, if the brain's messages are going through the brainstem, down through the upper neck, through the body, and out to the liver, and it's telling the liver to cleanse or to create hormones, and those messages are received properly, then the liver functions properly. But when there's a little bit of distortion, or there's a little bit of pressure, or worse, lots of pressure due to misalignments here, what happens is those messages don't get there properly, and now the cells don't function properly. And one unfortunately common abnormal cell function is cancer, right? And so if the cells don't function properly, and now they don't function properly for 5, 10, 15, 20, 30 years, we can develop disease processes and we can develop a liver that malfunctions.
I just thought of something else as you were talking about hormones. When I had just said before, your spine's not right, it affects you physically, mentally, and emotionally. So if the spine's not right, the liver can get messed up, but hormone production, neurotransmitters that are off, this can literally be affecting you in so many ways that you don't really appreciate coming from structurally you being off.
Absolutely. The brain does everything. It's the master control center, right? And so there's no cell or tissue or gland or organ that does anything outside of the brain's communication. And so the brain is the band conductor, so to speak, that's telling the trumpet section to play, telling the trombones to play. And if everything comes together harmoniously, we have a beautiful song, right? And so if the brain's messages are distorted and the glands aren't properly producing hormones, the hormones then start to affect the chemistry in the body, and the chemistry in the body then starts to manifest into symptoms. All of this can trace back to how our brain is running and dictating the show.
You had mentioned cancer patients out there. I think anybody looking to cleanse their liver, detoxify their liver. And again, I'm not making fun of it. These detox programs are great. All of this is important. But what a great extra thing that every person should do. Just make sure the spine is in good alignment so that you can encourage that self-healing response in the body.
Yeah. Well, geneticists have studied DNA and genes for years. And there's a thought process that it's our genes that make us sick or make us healthy, right? Well, they've actually said that it's not our genes. While our genes are our DNA from our mom and our dad, it's actually how our genes are turned off or on. It's genetic expression. And they've said there's two main factors that affect our genetic expression. One is our external environment. And so the external environment are the things that we're exposed to every day. The air we breathe, the water we drink, and this water is good. The medications that we take, right? And so if we can control our external environment to some degree, we have a better chance of being healthy. But they've gone further and they said it's actually the internal environment that's the single-handedly most important thing to have a resilient and healthy body. And they've said that it's the way our brain communicates with our body that dictates whether our genes are turned off or on and whether our cells are functioning the way they should or abnormally. And so the brain's connection through the brainstem, through the upper neck, through the spine and the nerves, and that communication back is so important to how our body functions.
Another thing you just made me think about, no pun intended, is the fact that our messaging, always my messaging to so many people listening to what I have to say, is you've got to think right about how to heal. But here it is again, I see how if you're not corrected physically in the spine, it's hard to think right.
Right. Yeah, absolutely. Absolutely.
So let's talk about, obviously falling from a tree and smacking your head, no joke. That can really twist and misalign the spine. But what else gets the spine out of whack that maybe isn't so dramatic?
Right. The reality is most people don't fall from a tree. But even me falling from a tree, we didn't know that this was an option, right? It took me 17 years for someone to say, hey, Dr. Rowe, you need to go check this out, right? And so the reality is it's stress. Stress affects the body in so many ways. And it's not just stress that, you hate your job or you had a tough day at work, or it's physical stress. And so in my case, it was falling from a tree. But it could be car accidents. It could be slips and falls. It could be working at a computer, 8 hours a day. These types of physical stresses place a lot of pressure on the nervous system and its ability to function. We've got the chemical stress. We've got emotional stress. Stress is what causes our body, and particularly the upper neck, to have pressure on those nerves and affect those areas. There's something called the dura, which surrounds our brainstem and our spinal cord, and it's like the skin around there. The dura's job is to manage stress. It's to help the body handle stressful situations. And so when the neck shifts because of prolonged stressful situations, this dura can create these adhesions, and that can affect our body's ability to, again, function properly.
I don't know if this is going to be making a lot of sense in an audio video like this, but I know that before I was on the internet, I worked a lot with people. And to be real practical for a moment, the stress of people, like you were saying, sitting at work with a computer, the monitor slightly off center, their head is twisted, the telephone is somewhere else, the way they lean on their right elbow, the way they pitch their legs under a chair and they prop their balls of their feet on the ground and putting tremendous stress through their legs into their hips, up into their spine.
Right.
It is so subtle and people don't notice it. And I found that a lot of people that came to me with physical pains or looking to be a high athletic performer, I would tell them, look, when you go away from me, be very careful how you're standing or sitting. Even those people standing a lot at work, standing on one leg, the list goes on and on, right?
Oh, absolutely. Yeah, and it's the little things over time become the big things, right? And so one of the things we look at is we look at posture. Posture gives us a really good picture as to what's going on inside, right? And so someone that's working at a computer doing all of these things that you're talking about, they develop postures and they don't even know it. It's funny because a lot of times I'll look at a patient when they come in and we'll look at their posture and they don't realize that one shoulder's higher than the other and their head's forward. And the forward head position is something that we're really studying now, especially in kids. This forward head position is when the head shifts in front of the shoulders. We call it anterior head position or syndrome. And this posture is a prolonged stress response to the body being in a position. And in kids, it's iPhones and tablets nowadays. And so these postures that we develop from working at a computer or repetitive stress to the spine, they can lead and they can manifest into things that are detrimental to how our body heals.
Yeah, I mean, no doubt what you just said alone, another thing that's so deceptive about a head that, I don't know, weighs 7, 8 pounds, being shifted forward like that on a spine. When people think about it for just a moment, wow, that's a lot of stress. Mm-hmm. Okay, so I came to you and I was fortunate to get to you. You really explained really clearly what you were going to do to me. Because my wife and I, we kid around all the time. For years, she told me, Jonathan, your head's not on straight. And I know I operate a little different than the average bear out there.
Right.
But she was literally right. My head was a little crooked, and you really made that clear. And then you outlined this whole plan. Mm-hmm. Jonathan, here's how we're going to go about it. So walk us through it from that first day. What's the most essential thing? I know we don't talk a lot about radiation being something that's good, but hey, you got to have an x-ray, but walk us through this. What would you say is what people got to do to straighten themselves out, literally?
Right, yeah. So the first thing we always do is we kind of sit down and we go through the stress, right? We'll go through a trauma history. We go through whatever situation is presenting itself because that helps us pinpoint areas of the spine that we need to address, right? And so once we're able to do that, then we look at range of motion, we look at posture. Because if our body's stuck in a particular range posture, or if our range of motion is decreased, what's happening is that joint's not moving. And if a joint doesn't move through its normal ranges of motion, one of the number one things it causes is pain, right? And pain leads to over-the-counter medications, or worse, prescription medications, which then affect how our liver functions and how our body functions. And so when we're addressing posture and we're addressing range of motion, we're trying to determine a baseline. Once we figure out exactly what areas need to be addressed, we take a very specific set of x-rays of the upper neck. We take a front view, a top view, and a side view, as well as a view of the lower spine, because anything that happens up here affects down here. We have a reflex called the riding reflex, and its job is to keep our eyes and our ears level with the horizon. And so if our head's leaning like this, what's going to happen is our body's going to shift and shift to try to bring the eyes and the ears level. And we call that the riding reflex, like riding a ship. And so when we take the x-rays, it allows us to not only determine how the bones have shifted, because the bones shift very differently. Remember, they don't have those interlocking joints. They shift side to side, they tilt forward and back, they rotate. In fact, I had a patient yesterday that came in with really bad headaches, and his top bone had shifted up to the right and twisted to the front over 11 degrees.
Wow.
Tremendous amount of pressure and rotation being placed on this gentleman's skull. And so once we can figure out how they've shifted, then we also can figure out how we can correct them. And we use a digitized software that tells us exactly how to correct these misalignments down to about 1/4 of a degree. And so through time and through repetition, we can work on reducing these misalignments, allowing the brain's communication to the body to be restored.
Just out of curiosity, he didn't fall out of a tree. What caused such a massive shift?
He works at a computer 8 to 10 hours a day. He's in software. And so he travels, he works with hospitals, and he works on a computer.
And so, like what you were saying to me, even though you're an upper cervical chiropractor, you're fixing me literally from the top, or anybody for that matter, from the top down. Is that right? Can you explain how you kind of, I noticed that, traditional chiropractors, they're like, adjust you all over the place.
Right.
You didn't do that with me. You were just really gentle, no pain at all, addressing the misalignment upstairs. And then you were saying how things change over time. Can you talk about that for a moment?
Yeah, absolutely. So when the atlas shifts out of position, our head's like a bowling ball sitting on top of this little broomstick. And so for every inch forward the head shifts, it increases the weight perceived by about 10 pounds. If the head shifted this way, it causes these structural changes. And so by addressing how the top bone is sitting in the neck and then how the skull's sitting on top of that, if we can start working on bringing that bone back into a more normal position, it's going to allow the body to change. It changed to adapt to the bad position. It will change over time to adapt to the good position. And then we can go in on the other areas and we can work on those as well. Because when we take the x-rays, it also allows us to see if there's degeneration or arthritis. And so degeneration arthritis, a lot of people are led to believe this is the aging process. And the reality is that's not true. Degeneration in the spine comes from a prolonged stress response. And so when the bones shift out of position, they start to cause stress and strain on the disc and the joint. And so like we talked about, range of motion is so important. Our spinal joints are just the same as our shoulder, our knee, or ankle. And so if our joint can go through its normal ranges of motion, then the body will function properly. The brain will protect that joint and send the message to that joint so it knows everything's okay. But if a joint gets stuck, now it stops moving. And so when it stops moving, it sends messages to the brain. The brain sends messages back and it shuts down the motion there. And so in the case of the spine, that disc will stop getting fluid into it. It's going to dehydrate, so it's going to start to thin. And as that disc thins and thins and thins, what happens is now the bones start to grind and scuff. And we develop over time degeneration or arthritis. Well, as that disc compresses, it starts to damage the nerve because the disc's job is to protect the bone and the nerve. And so as that nerve gets damaged, say that nerve's going to the liver. Now that nerve's damaged more and more and more, and now the liver starts to have problems. And so when we're looking at the x-rays, we look at degeneration both in the neck, the mid-back, the low back, and that tells us that that area has been wearing away or there's been a problem there for a long time. And that also helps us address and figure out what type of care an individual needs based on what we're seeing on those films.
You just spoke about a very empowering message. Western medicine would say it's age. Mm-hmm. There's nothing you can do about it, is basically what they're saying, whether they say it or not. And what you say is so different. When I sat with you that first time, you made it so clear, hey, Jonathan, you're heading in this direction.
Right.
Let's fix it. And another exciting thing I'll just throw out there was from the very first time I saw you, I said, that's it? And you said, a lot of people say that.
Right.
I said, that's it? That's all you're doing with my upper spine? And I noticed how immediately, it's very hard to explain in words.
Right.
My head felt better. It was more free. But I noticed very quickly within a week or two, without you, crack, really adjusting everything in my, lower down the spine, middle, and even in the back, my spine started to be able to move more. Mm-hmm. And I knew the clicking and the popping that I could do just by myself felt really good, and I could never do that before, and it was simply by you getting my head on right.
Right. Absolutely. Yeah, just getting that head and that neck aligned properly is going to take the stress off the rest of the body and the spine.
So is there anything else as we're closing out, Dr. Rowe, that you'd want to communicate to people? Maybe something like along the lines of, they've been wearing themselves out for 10, 20, 30 years. How long a process is this? I mean, for me, you told me what?
Yeah, so when we looked at your spine, we saw areas that were wearing, and you had areas of the spine that were correctable. But sometimes they're not correctable. Sometimes they're only patchable. And so once the spine gets to a certain point, we can't reverse that process. We can only maintain and manage it. And so sometimes that process is 5 years, 10 years, 15 years, 20 years. It just depends on how long the problem's been there. But the better part of this is don't wait till the problem happens. We see babies in our office, not because they have spinal issues or because they have medical issues, but because the birth process is traumatic. The American Journal of Pediatrics says the average child falls about 5,000 times by the time they learn to walk and ride a bike. If you or I fell 5,000 times over the next 5 years, we'd probably be in a wheelchair, right? But kids brush themselves off, you know. The likelihood of one of those falls shifting the spine out of position, causing problems then, but 5 years from then is very high. But the likelihood of that child communicating that with the parent is low. You know, brush yourself off, Timmy, go back and keep playing, right?
Oh, and Dr. Rowe, you just brought up something that reminded me. What's amazing for a lot of parents out there with kids who are constipated, or even perhaps even adults, you had mentioned, it's amazing how much you see kids, you get their spine right, they don't have to take all these bowel drugs and all these over-the-counter things to get their bowels moving. You just fix their spine, and now all of a sudden their gut is working better. They eliminate better. Talk about getting toxins out.
Absolutely.
It's just get the toxins out by getting your spine right.
Absolutely. Yeah, that's one of the number one reasons we see kids for bowel issues, colic, reflux, you know, digestive issues. And when we have these long-term chronic digestive issues, it leads to serious problems.
Great info. Dr. Rowe, I know this message is going to get out to a lot of people, and it's going to motivate them to add this as part of a healthy lifestyle, no doubt. Thank you very much.
Oh, thank you. I appreciate it.
With only 2 days left, I'd like to remind you, if you'd like to own a copy of the Fatty Liver DocuClass, plus all the other bonuses, simply click the link below and choose the package that best fits your needs. And now, I'd like you to meet Dr. Moshe Deckel, a board-certified physician with over 40 years of medical experience, helping people to feel better. Dr. Deckel will show you how the liver is directly affected by the gut. A serious warning will also be issued about the digestive system. He'll also talk about why liver enzyme testing is not enough and what you need to know before you experience a health crisis. In terms of energy medicine, you'll gain a greater appreciation of kinesiology, what exactly a liver point is, and how to use energy medicine to make better health decisions. Plus, the latest news about stem cell therapy and its potential for restoring liver function. Enjoy. So, Moshe, you got to tell me. I got to ask you.
Okay.
How did you get from being a conventionally trained medical doctor to sitting here the way you are today? What happened to you?
What happened? It's a long story that I'm going to make it very short. I started clinical medicine in 1975, started my practice in OBGYN in 1981. And for about 19 years, I was a solo practice, OBGYN, very busy. But the last 5-7 years in my practice as OBGYN, I started to experience neck pain and back pain due to doing this 5 hours a day, doing surgery, looking down at the table.
For people who may not be familiar, what is it that you actually did?
Well, I did surgery. I did obstetrical and gynecological surgery and deliveries, of course. And when I had these issues, I went to see my chiropractor. I used to do neck traction. I used to do trigger point injection. I tried everything to take care of it. But one thing I didn't do, and that is changing my habits. Either you do surgery or you don't. And then back in 2000, I was getting ready to do a delivery, and I was changing into my scrubs to go into the delivery room. And a sudden back pain put me down to the floor. And I was like, what just happened? So I crawled to the on-call bed and just kind of rested for about 10, 15 minutes. I kind of made myself arrive at the delivery room and finish the delivery. But the big aha moment hit me and said, you know what? You did everything except changing your habits. And that's when I realized that I couldn't continue with surgery anymore. So obviously it was not a good day when the door slams at your face like that. But luckily I concentrated on the door just open, which was holistic medicine, which I knew nothing about, just very little things. And I think by either luck or design, I opened the door and I said, wow, how much they didn't teach us and why? And that was my new medical school back in 2000. Had to accumulate the knowledge, take courses, read books, talk to other doctors that have been there before me. It was not easy 20 some years ago. But as we sit here today and I look back, it was like yesterday. So, anything that happens that we don't like or think it's unfortunate, let's look at the open door and do something else.
Yeah, it's interesting the way you're putting that, because I think a lot of healthcare providers listening to you right now, well, hopefully they will be able to listen to this, even if there are people out there who say, you know what, my healthcare provider's got to hear this. If they're frustrated,
Yes.
or they feel overwhelmed in their practice and they don't know what to do, and look at what happened to you. It was smacking you in the face. You like really, truly couldn't continue. Yet you still looked at, all right, this is an opportunity, not such an overwhelming thing, and you have to just continue to suffer and stay the way you are. You really saw this as a great opportunity. And now look at this. You get to sit here and do this kind of stuff.
That's right. And luckily, it didn't continue just incrementally to the point that you can deal with it. It just really cut the cord. So for doctors who are looking to change, if it doesn't hurt too much, they're not ready to make the change.
Yeah, isn't that amazing? It's just like anyone watching this. Look, me included. Unfortunately, it seems this way. When I was younger, it was hard for me to accept this idea of people are just they're not interested in making a change until something's so sudden.
It's hard to make changes, but the thing is, if you're not happy with your results, if you're not happy with the fact that people get so many side effects about medication, etc., open the door. Start reading, start talking to holistic doctors, look at some conferences, just see if there's something that you want to really understand and change your practice.
So let's jump right into the liver, because that's today's discussion, right? Somebody does have that little pain maybe on the right side of their body, or, they've been listening to maybe some of the other conversations I've had with other doctors, and just their intuition is screaming at them. Something's wrong. So before something gets even worse, why is the liver so important? Talk about that as we start this off.
The liver is a major detox organ. We have about 5 elimination channels. We have the liver, we have the gut, we have the kidneys, we have the lungs, and we have the skin. The liver actually is the goalkeeper for the gut. Everything that happens in the gut, every molecule, every substance get absorbed through the intestinal tract, has to go to the liver to actually verify that this is allowed into the body. Okay, so the liver is the guard to take care of any toxicity, to take care of any other issues that may hurt our health. So without the liver, or if the liver is not up to par, it affects every aspect of our existence and our health. The issue is that we may not even have pain. I just don't know about it. We just don't feel right. Okay. And that's the combination of what I think we should talk about today is like, okay, what do we do? How do we find out? And where do we go with it?
So let's roll right into that now. Maybe on a medical perspective, how do you evaluate that something's wrong with the liver? But I think also on a practical side, like what you just said, somebody's out there and, they're concerned because they've been hearing a lot of this content that I'm presenting, but they're not too sure, and maybe they're not ready for a medical test. They're not sure if they need a medical test. Maybe their liver's fine. What are some of those signs maybe that would tell a person, wait a minute, I should look at my liver more carefully and enroll into talking to me about, on the medical side, what we would do to evaluate liver issues? Talk about both of those things.
Well, any kind of general malaise, any decreased amount of energy, any digestive issues, any heartburn, any increased gas, constipation, all of them really affect the liver. To what degree, then we can find out. But it's not that difficult to actually assess liver by taking a regular blood test. We look at liver enzymes. And if we have liver enzymes elevation, that means what? That means that we actually have hepatic cells, liver cells, that have actually died, opened, and released enzymes. And now we see it in blood. But we need to be aware of the fact that we may have liver issues without liver enzyme elevation. Okay, so in holistic medicine, what we do, actually, one of the easiest way to find out is really to do kinesiology or muscle testing. And we find out energetically what's happening before even any blood tests get a little skewed or awry. And we deal with the entire system. We go down to the foundation to help the liver. In addition to, obviously, we can help the liver per se, but it's more than that. It's deeper than that. The liver is really the tip of the iceberg. Let's go to see why is there a problem.
And this is important, a point that you just made. People might take a blood test. Their liver enzymes aren't really elevated. You got to be a little careful. If they're experiencing other issues, I'd like you to talk about some of those just practical things that people might be feeling. You mentioned a couple quickly, but let's talk about that. What people are going through that would be an indication that there's a liver problem, even if their enzymes are not elevated. Talk about that.
Right. Well, as I said, when the liver is not functioning well, you're going to have a decreased amount of energy. It's not the only reason. It can be a part of it. But whenever somebody feels a little not up to par, and it's not just like 1 or 2 days, but it continuous decreased amount of energy, it's a good time to take a look and say, okay, is it my liver? And what else is going on? Because again, it's not going to be just isolated liver. Okay, so obviously if you have any sign or symptoms of getting jaundice or getting, yellow eyes, yellow skin coloring, etc., obviously it's increased amount of bilirubin that's in the system and it shows it. But again, also the liver and the gallbladder are very joined at the hip, so to speak. So we can have also a gallbladder issue that manifests itself, as I said, in changing the color of the sclera of the eye to become yellow, etc. So any of these items that are kind of not typical, okay, it's not like you would have fever or you all of a sudden can't get out of bed. It's a kind of insidious. It's slow, usually progressing, unless we have, hepatitis. I mean, if we go to a restaurant and we get hepatitis A, you're going to get sick, and you know that you can't get out of bed, and you're going to get fever, and you're going to get yellow, et cetera, et cetera. So this is typical hepatitis.
Now, I wanted to get your medical perspective on this. I know other people have talked about this issue. You mentioned about the gut. I think a lot of people in Western culture tend to isolate things. There's a problem with your gut, fix your gut. There's a problem with your heart, focus on your heart. Or the brain, it's just in the brain, nowhere else. But you already mentioned something interesting so that people could appreciate this. I want to get your take on it. That if someone had gut issues, almost certainly there's a connection to the liver having an issue as well. People need to understand that, right?
Oh, absolutely. If somebody asks me, listen, give me one sentence about how to keep healthy, I say, take care of your diet, take care of the gut. Let's be a little more specific. Inflammation, okay? And we have two types of inflammation. We have a chronic inflammation, we have acute inflammation. The body uses acute inflammation as a defensive mechanism against organisms, against viruses, bacteria, and everything else that invades the body. It uses inflammation to save us. And that's absolutely good, and without that, we cannot really survive. However, when it becomes chronic, now we have a boiling pot right here, and it can go anywhere. Now, obviously, it's going to go to the liver because everything happens in the gut, I just mentioned before, has to go to the liver. So the liver is going to be affected by it. So it's what we eat, how we digest, how we eliminate. Do we have enough probiotics? Do we have enough digestive enzymes? Do we have enough hydrochloric acid? It all depends how deep you want to go into this, so I'll let you lead.
Well, going back to one thing you already mentioned about kinesiology.
Yes.
You said that quickly. Besides a blood test, what's this thing you do with kinesiology to help people understand something might be going on?
Right. Kinesiology is a modality that has been developed 50 years ago by a chiropractor. Okay. The idea is that the body responds to things that are good for it with muscle strength. Okay. And there are various ways to deal with it. The chiropractors usually use the deltoid muscle, the strength. I use a different modality called the O-ring method. various ways to do it. But anyway, what we're able to do as holistic practitioners that are aware and knowledgeable in kinesiology, we can tell what's happening energetically in just about every system in the body. And it's so deep and so, it precedes any other issues. In other words, before we see any lab testing an issue, I can tell by checking the liver point, which is a combination of Chinese medicine, acupuncture points, and organ points. Check that liver point, and if it's weak, I know energetically there's a problem. And then I have to connect it. Okay, what else is an issue? Is the stomach an issue? Is the small gut an issue? Is the colon an issue? Is the gallbladder an issue? What happens? Not only that, but you can actually tell what changes need to be made as far as diet is concerned, but also what kind of supplementation will affect and will ameliorate those specific issues that we find in kinesiology.
So again, I know a lot of people might still be trying, it sounds interesting, but they still may not be getting it. You had talked about how you might, is it saying or holding something close to them and testing their strength with their arm. You don't do that. You say you do something.
The O-ring
just
method.
Explain that.
Yeah. So what happens is the following. Anything that gets into our energetic field, which is the aura, which is all around us, okay, at about this distance, okay? Our DNA knows it. Our DNA is an antenna.
Let me interrupt you, see if I got you right so far, all right? This may be like, I can hear the voices out there. Oh, come on, this is real woo-woo stuff. But on a practical level, this aura you're talking about, this invisible field, if you will, that we all put out.
Yes.
To me, the way I relate to this, that it's so real, is if you walk into the room and you get that sense of you like someone, you're immediately feeling something. You don't know the person hasn't said anything, you've never had a conversation with, you don't even know what their name is. You get this feeling of yes or whoa, no way, stay away. It's got to be this output, if you will, of this energetic field that you're describing. Am I way off?
No, absolutely on target. And we call it gut feeling, right? Or sensation that we have that we can't explain, but we know it's real. And it is real. And by the way, kinesiology or muscle testing is actually based on quantum physics. Now, I don't want to talk about quantum physics because I don't know quantum physics. But if somebody is want to research that, look into quantum physics and kinesiology, and you can actually see that you can actually explain that phenomenon if you're interested in knowing quantum physics. So it is scientifically proven.
And just to kind of help this along to see if I get it right? That's why I'm doing this, right?
Okay.
Hopefully maybe other people learn something from this.
That's right.
So the idea is, let's say I'm holding, a cup of water, right?
Yes.
And I want to know if this is going to be good for me or if it's a multi-vitamin or whatever it might be. Our thoughts and our feelings, we can either strengthen or weaken because of what's going on with us. But this is not necessarily most of the time on a conscious level. So is that fair to say that what you're doing is, in a sense, with kinesiology, and I want you to go into that technique that you use too, you're revealing to the person in a more conscious way, hey, don't you see? This thing is making you stronger. It's okay to continue. Or this thing that we just tested is actually weakening you. Stay away from it.
Right.
Am I on the right track?
You're absolutely on the right side. And again, I do understand that people have a problem with that. I tell you why. Because when I saw it for the first time, I had a problem with that. I said, really? How can it be true? But I've been doing it for 20 years. And after 20 years, when you get results, I don't even question it. But to your question, I showed my patient what this is about. Okay, so I test them. Okay, by using it's almost like a figure of 8 that you put in between the two fingers, and you tell them, okay, hold it for a second, and I test their strength. Okay, obviously with two hands It's not a matter of finding to prove that I can open it, obviously. But I see their initial strengths, which is called testing in the clear without anything. Okay. Then if I bring anything to their energetic field, and usually it's a cell phone. I said, can I borrow your cell phone? Good. Hold it to your chest. Do this. It's like they're weak as a puppy.
So Moshe, I got to ask you, can you show me how this kinesiology works?
Of course. It's not hard at all. So the method that I use actually is called the quantum reflex analysis. Okay, it's a methodology that was put together by Dr. Bob Marshall. Okay, and it's using those two fingers of the hand, and we feel that this is more reproducible than using the deltoid muscle.
And it's the thumb and the third digit?
And the third digit.
Okay.
The fourth, actually. Yes.
Okay.
Okay, so what we do is I want to ask you to hold it tight, don't let me open it. Okay, great. Now, obviously, now relax. Now, obviously, with two hands, I can open two fingers. That's not the issue. But what I did, I tested your strength in what we call in the clear without anything, okay? Now, what I want to show it to you is, can your body tell you if something that I bring to the energetic field is it good for you or not? So let's use a cell phone. Okay, so just hold it to your chest. Okay, and now let's do the same thing. What happened? It opened very easily. Okay, so in other words, your body is saying, no, thank you, I don't want this. It has EMFs, etc. It's not good for me. Okay, this is the basics of quantum reflex analysis or kinesiology. Okay, now there are ways to say, because people say, wait a minute, I need to use my phone on a regular basis. Am I endangering myself? Well, the quantity of how much it is disrupting us is we cannot say, but there are ways to actually overcome that by having a certain protection on the phone, so it does not affect the energetic field. And if you want to try it, I just happen to have here.
Yeah, let's see how this works.
This is like a modified magnet, so you can do one finger like that and just put it again to your chest. Okay, strong.
Wow.
You see the difference.
Yeah.
So this is really the basics of kinesiology. We can do with just everything, with organs, with food, with thoughts, with statements. It's totally unlimited because it really goes to the subconscious and it gives you the true answer, whatever it is.
Right, so in other words, like for liver, I mean, we talked about liver this whole time, right? And this is a fatty liver docu-class. I guess I got to ask you, should we check out my liver? And see
You can. Now, let's assume that it's got to be weak or strong. Strong, great, no problem. If it's weak, that doesn't mean you have fatty liver or anything like that. That means energetically, your liver can need a little support. And then we can find out, for instance, what can help it. So the point, two fingers, okay, you put these two fingers right under here on the ribs. This is the little higher.
The lowest rib?
Nope, right here under the nipple.
Okay.
This is in Chinese medicine, that's the liver point. Okay, so let's see. Strong? It's not that strong, okay? It's not weak, but it's a little less what I would like it to be. So how about we kind of bring milk thistle to the field?
So in other words, if I say milk thistle now with you as my doctor,
yes,
before I even take milk thistle as part of a supplement,
yes,
that would be an indication whether milk thistle is going to help me with my liver weakness or not.
That's correct.
This I got to say.
I know. Okay, so this is now without anything. Strong? Okay.
Right, it came apart.
Okay, go ahead.
So I say milk thistle.
Yeah.
Milk thistle.
Strong.
Wow. I'm keeping it together.
Yeah, well, obviously and I can separate, but you can see how much energy I put and still not separating.
Yeah, absolutely.
Right.
I can see that would make me stronger. It did.
Yeah.
Just by saying it, because it's energetic.
It's all energetic. So what we do is we actually sending the energy of milk thistle, even though we don't have it here, into your energy pattern and say, well, if we take milk thistle, would it strengthen the liver energy? And the answer is yes.
So it's interesting. Almost, as I don't want to put words in your mouth, almost all the time, something that I've warned people about all the time, this wireless radiation, almost always that's a destructive thing to have close to your energetic field, right?
Absolutely, because what you do when you're asking about it is that's good for you. And they look at me and they look at the phone. It's like bewilderment. They say, what did we just do? I said, we asked your body, do you like this EMFs? And the body says, no, thank you, I don't want it. And then to make it a little more adventurous, I said, tell you what, let's check it again. Let me use my phone. I gave them my phone. And they check and they're strong. I said, like, what now? I said, well, my phone has protection.
That's it. You tricked them. Okay.
So it's like it breaks the barrier. Now, listen, not everybody's open to it, and I understand it. Okay, but I said to them, listen, if you don't get better in 2 weeks, you need to tell me because I missed something. And I don't like to miss anything, and I don't. I tell them very simply, if you do what I tell you to do, in 2 weeks, you're going to feel better.
And relating back to what we're talking about here about liver health, clearly, don't eat so much fast food. You're pouring chemicals down your esophagus. Obviously, this is not something to do, but in many cases, it's more subtle than that. What kind of toxins, environmental toxins are you exposed to? What kind of foods really are weakening you? Even if they're perhaps what a lot of people would think are healthy, the bottom line is, if it's weakening you, it's going to weaken your liver, it's going to compromise your digestive system, it's going to be compromising your entire immune system. Fair to say?
Oh, absolutely. And the thing is, what we can do muscle testing for food. So we can tell people, hey, this food you're not ready for. Now, I tell when my patient asks me, okay, what should I eat? I said to them very simply, when you go to the grocery store, ask yourself 3 questions. Number 1, did God make it? Number 2, did men touch it? And number 3, is it organic? Now, if you are sensitive to any food, that means what? That means that the gut is not in a perfect shape and we need to fix it. That's called the leaky gut syndrome, which all of us have it to one degree or another. And of course, how to fix it with the right diet, the right support, and also using variety of compounds to actually help heal the leaky gut, which is actually increased permeability. In other words, the cells of the gut, instead of being nice and tight, we have microscopical openings that allow stuff to go in that's not supposed to go in, creating what? Chronic inflammation. That goes any place according to whatever. It goes to the heart, we have a heart problem. It goes to the kidney, we have a kidney problem. It goes to the joints, oh, now we have arthritis. All autoimmune diseases are related to gut.
And I know a lot of people out there are, and this may not seem like there's much of a connection, but talking about skin issues in particular, like psoriasis, eczema. This, again, draw this relationship between these outer visible skin issues having a lot to do with the liver.
Absolutely. So we said already that we have 5 elimination channels. The skin is one of them. The liver is another one. Well, what happens if the liver gets burdened? The skin says, okay, you know what? Let me help you. The skin cannot do what the liver does. So the skin gets inflamed. So for any skin condition, instead of putting cortisone, which doesn't work, okay, let's get to the deeper level, which is skin. Okay, I have a skin issue. Let's take care of the liver. But the liver is related to the gut, right? To everything that we eat, to everything that we consume and digest. So ultimately, it's a combination of going from what we see a little backwards. Okay, we find the source, fix that, and the skin just get beautiful and shiny and no problem.
All right, so Moshe, let's talk about this a little bit more.
Yes.
Obviously, food is a big deal. Even people doing the best they can with organic foods, right? I mean,
Right.
How does this whole picture of food equate to liver health? What do you say to people?
My general rule is the following. I say to them, listen, first of all, you have to avoid wheat. Most likely you have to avoid gluten, dairy, and sugar. Now, I look at their reaction because some people like dairy. I like dairy. So I see the cringe on dairy. It's like, I I want my dairy. I said, no problem. Let's give you a substitute. How about dairy from goat or sheep? Okay, so you have goat milk. You can have cheese from goat's milk, etc. So they kind of get a little better. It's tough for people to change. So what I try to do is give them alternatives. Okay. As far as milk, almond milk, rice milk, coconut milk, etc., absolutely good for you and no problem. As far as wheat is concerned, obviously it has gluten, okay? But if you don't have organic wheat, it has glyphosate, Roundup. So sometimes we don't know, are you reacting to the gluten or are you reacting to glyphosate? Or both? So, and some people say, listen, I need my bread. I said, okay, how about we do sprouted bread, like Ezekiel, or any other brand name, it doesn't make any difference. Now, it does contain wheat, but what happens is, number one, it's organic, and number two, it's sprouted. So it looks, when the sprouting start, when seed gets to water, it looks like the gluten gets through its transformation that doesn't affect as regular wheat. So I find that 95% of my gluten-sensitive patients can actually tolerate sprouted wheat.
There's something you're bringing up that's, number one, two things. Sounds to me like you're dealing with people who don't want to separate from something with some serious addictions.
Oh, absolutely.
And that's unpacking a whole other bunch of issues in terms of being addicted to sugar in general. I'll have you comment on that. But number two, also, people may not want to give up something because they're just looking for that feeling that they get from eating a food that they're used to a lot, creamy, crunchy, a little salty. So it sounds to me like you're trying to energetically change people by getting them to eat higher quality food. But what I'm trying to get at is, a lot of times when people are just don't want to give up a certain food that might be hurting them, maybe they just switch to something else that, gives them that satisfaction, but it's a heck of a lot healthier. And then maybe their inflammation calms down, their liver's going to feel better, their whole life changes, right?
No question about it. You raise a great point. The hardest thing I find with helping people change is when it comes to diet. In fact, I have cancer patients not willing to give up sugar or carbs for that matter. So I recommend really, they say, what do you recommend? I recommend really ketogenic diet. I hate to say diet because diet means hard to do, temporary, etc. I like to use lifestyle. Okay. In general, increase your fats, the good fats, and decrease your carbs. But you're absolutely correct as far as say, why is it so difficult for people to get off of sugar and wheat, etc.? Because the gluten, what happens at gluten, the fact that some people cannot digest it, okay, it actually, the byproduct of incomplete digestion of gluten actually acts on the cocaine receptors in the brain. It's addictive. So it's destructive because they cannot digest it, they get inflammation, and they can get as far as Crohn's and ulcerative colitis and the rest of it. That's the end of the story. Or they can get IBS, or they can get other symptoms, etc., that they don't even relate to the fact that that's gluten sensitivity. And yet, if you take it from, let's say, a sprouted type of a grain, there's a more likelihood that you probably can tolerate it. And the same with, pasta, etc. There's so many different pastas today. You really don't have to do a wheat pasta. I also hear that patients of mine who actually use grains and actually wheat that comes from Italy don't have that issue as wheat in the States. So, there are various ways to deal with it. So for people who really find it very difficult, let's try to find a way for them to help themselves by finding something that really works for them.
Like you said too, though, in certain situations, could be many more than most people realize, it's not necessarily the wheat, like what you just said. They get it from another country without the glyphosate, And really what their issue is the certain types of foods that they have been eating over and over again. Too much, perhaps wheat, sugar, but it's also highly toxic. Just like when you said about conventional dairy, right. It's not like we're trying to bash all products that come from that are dairy, but most conventional dairy is filled with all kinds of toxicity. So now again, back to the liver, maybe in a lot of cases for those people, it's too many years consuming too much toxins, storing up and wreaking havoc on the body.
Absolutely. And lack of detoxification. In other words, in order to help the liver, we need to detoxify the liver. Okay, so there are various ways to do that. But I actually am very happy you brought the fact of regular milk versus, let's say, organic, grass-fed, raw milk. Majority of people have no problem with that. And nowadays we have co-ops. I know that in New York you can get it, in South Carolina you can get it, etc. I'm sure in Florida you can get it too. Because people realize that feeding corn to cows who are meant to eat hay gets them inflamed. Therefore, what? The milk is inflamed. Okay? Meat from beef that is grain-fed, okay, will have omega-6, omega-9, which is inflammatory, versus if you have hay, they have omega-3, which is anti-inflammatory.
Oh, that's a great point, too. Again, not bashing the animals.
No.
It's really highlighting the way the farmers are producing the food by how they're taking care of the animals. And the ratios in those animals are more either healthy or sick. And then why is it so hard to believe that then what we take as a food product from those animals, if they're sick, it's going to make us sick?
Not only that, but let's take stress. When they have 2x2 space, don't you think that's stress? Well, what's the byproduct of stress? Inflammation in humans and animals. So if the meat is inflamed, guess what? We're consuming inflammatory food. Well, and where's it go? To the liver.
Yeah, so energetically, we're consuming, and again, that may sound out there for people, but boy, does it make a lot of sense to me. Energetically, we're consuming that fear of those animals, all that stress,
absolutely.
And boom, that's going into our system as well.
Absolutely.
So what other kind of food tips are you giving people looking to have a healthier liver, healthier whole body for that matter?
The majority of us eat too much. It probably resonates. So I tell them, listen, first of all, eat when you're hungry. There's no rule that says we have to eat 3 times a day.
What if I'm hungry all the time?
Then we'll say, okay, let's find out why. Are you really digesting the food? Are you really assimilating the food? Or are you not digesting, etc.? And your body is starving for nutrients. Okay, so that's one thing. Another thing could be emotional. So let's treat that. I mean, the emotions are controlling or effective or causing 90% of physical findings, and nobody's talking about it.
So someone's, I don't want to sound judgmental because I don't mean it that way, but someone's toxic emotions, something that's really rattling around inside of them that's bothering them so much, whether it's even on a conscious level or not, it's just something's going on. Usually probably somebody else sees it in that person more than the person themselves, is actually driving them to eat certain foods. You feel like that's a really big thing?
Absolutely. Okay, let's talk about serotonin for a second. All right, serotonin is a neurotransmitter that is the make me feel good neurotransmitters. Very few people know that 90% of serotonin is made in the gut. Well, if we have inflammatory gut, we're not going to make serotonin. We're not going to make serotonin. We're going to be what? We're going to be depressed. Now, let's put this aside for a second. What happens when we consume sugar? Sugar actually helps the brain make more serotonin temporarily. So what we do is we are connecting sugar with feeling good. Sugar is actually more addictive, some people say, than cocaine and heroin. So yes, we can all explain it, find out what's going on. So again, as you see, from wherever we start, where do we end up? In the gut.
And it's interesting, I think probably what would reveal it, although maybe not the best recommendation, what I'm about to say is,
Okay.
if family members wanted to test something like this, if they see someone reaching for food constantly that's no good, imagine what it would be like if the person wasn't allowed to eat that food. All hell would break loose, right? And boy, would that reveal. Again, I'm not recommending it for anybody, but I think the point is clear. It would really reveal that, wow, there's something far more going on here than just, hey, I'm hungry, let me have some food. Wow, what's with all this emotional stuff going on? It's a real warning sign, no? That something much deeper has to be dealt with.
Absolutely, but also let's assume, that a lot of Americans actually consume a lot of carbs. Carbs, by definition, really are quick metabolism. Okay, so what happens, depending on what carbs we take, especially if we take a non-complex carb, converts to sugar very fast. Okay, so what we do is we eat carb, we get a high sugar. Now we have the manic portion of we feel good. I mean, it's like we can conquer the world. But for every hour we feel high because of sugar, carbs, we have a 2-hour period of feeling down. So it's really a non-starter to begin with. So if we are continuously hungry, we have to see, okay, what are we eating? What if we start consuming good fats? Okay. Fat takes a long time to what? To digest. It does not convert to sugar. Okay. It converts to ketones. Every cell in the body that utilizes ketones, including the brain. There's only one cell in the body cannot use ketones, and that's cancer cell. How good is that?
That's good.
That's good. So again, it's a conversation that patients have to have with their holistic doctor to say, okay, why am I so craving this? And if they're open to what we're just talking about, and they look to get more information, they're going to start understanding, wait a minute, I'm not crazy. This is physiology. This is what's happening because this is the way it is. That's the way the body reacts to high carbs, which, by the way, the government told us that we need to have 5 servings of carbs 50 years ago, the famous pyramid, which is really upside down. But that's a different story.
Moshe, everything we're talking about here, it just seems like if it's not under control, it's a vicious roller coaster, what we're describing, creating a lot of oxidative stress.
Absolutely.
That's what I want to talk to you about now is, and I think also, obviously, at the beginning, we should say the obvious. If someone isn't open to this, and it's more important for them to have their sugar, then, game over. None of this is going to help. But if someone's looking to really, it's more important for me to feel good and have that piece of cake or that half a bag of pretzels or that umpteenth number of bagels that they've been eating or pasta, then this is really important because the bottom line is this negative way of eating is creating